Hi there, this is Nursing Education Videos. Today I will be going over Barbiturates Pharmacology Nursing NCLEX review on Anxiolytic, Sedative-Hypnotic on registerednursern.com. I will be reading the review notes. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Barbiturates are medications that help calm and depress the central nervous system. This review will discuss the mechanism of action of barbiturates, what conditions they treat, nursing implications, side effects, and patient education. Don't forget to watch the barbiturate lecture and take the Barbiturates NCLEX questions quiz reviewing this material. Barbiturates Pharmacology Nursing Review. Barbiturates are a class or a group of medications that depress the central nervous system, CNS. Therefore, they produce a calming and sedative effect to the central nervous system. How to recognize them. Most generic names end with barbital or ital, so ITAL, with an exception to a few like primidone, so it's seizures. So phenobarbital, I think it treats seizures and increased ICP, says here. And then pentobarbital is for veterinary medicine or capital punishment. So veterinary medicine or capital punishment. And then secobarbital is prior to surgery. And butalbital are for migraines in combination with acetaminophen and caffeine. And methotrexate is an anesthesia. So used for seizures, insomnia, anxiety before surgery, so anesthesia, migraines, and increased cranial pressure. So there's an asterisk here. This class of medications are not as commonly prescribed for anxiety or insomnia as in the past because they have a very low therapeutic index, meaning there is a small threshold between the therapeutic dose and a toxic dose, which has contributed to many accidental overdoses in the past. Instead, they've been replaced by benzodiazepines for these conditions. How do they work? Mechanism of action. Barbiturates amplify the effects of the neurotransmitter GABA. GABA stands for gamma aminobutyric, so aminobutyric acid, by influencing GABA A receptors. So it spells here GABAA receptors. GABA is an inhibitory neurotransmitter. What is a neurotransmitter? It is a chemical agent produced and released by a neuron that transmits messages to a specific structure that it was designed to target via that target's special receptors. Many times the target is another neuron. Neurotransmitters can be grouped as being excitatory or inhibitory. Some neurotransmitters can do both, depending on where they are acting in the body. However, GABA is one of the main types of neurotransmitters in the body that is an inhibitory neurotransmitter. What's the difference between excitatory and inhibitory neurotransmitters? Excitatory, they excite and increase the potential of an action, like the neuron firing and the message being carried out. If we were treating anxiety or seizures, we wouldn't want to excite the neurons even more, but calm them down. Inhibitory. They impede and decrease the potential of an action by preventing an action, hence stopping the message from being carried out. This helps create a CNS depressant, so central nervous system depressant state or calming effect. The neurotransmitter GABA binds to GABA receptors. Many GABA neurons are located in the limbic system, which is the place in our brain that helps us process our emotions and the way we behave. Now, there are two types of GABA receptors, GABA A and GABA B receptors. Barbiturates influence GABA A receptors. GABA A receptors are ligand-gated, or also called ionotropic receptors. These terms describe how the receptor works to complete its job. When these GABA receptors are influenced by barbiturates and binding occurs, a channel opens to allow the movement of ions into the cell, specifically chloride. This is going to majorly affect how the nerve fires, hence it will inhibit action potential. Now, let's take a closer look at these types of receptor and how they work to depress the central nervous system. GABA A receptors have the following characteristics that allow them to work. The receptor is designed with 5 sections, notably called subunits: 2 alpha subunits, 2 beta subunits, 1 gamma subunit. In between these subunits is a hole, so a pore that contains a channel. And when the channel opens due to binding, it allows chloride to move through the channel into the cell. This causes hyperpolarization and is responsible for inhibiting potential action, hence providing calm, tranquilizing effects. It has various binding sites, notably 2 sites for the neurotransmitter GABA, found between each alpha and beta subunit, and a binding site for the barbiturate on the alpha or beta subunit. So, what happens? Neurons release the neurotransmitter GABA. GABA rains down onto the GABA A receptors and finds its binding site between the alpha and beta subunits. Now, if a barbiturate has been administered, its chemical substance that is hanging out finds its special binding site at the alpha or beta subunit. Then, due to this binding, the channel opens and chloride flows down into the cell and hyperpolarizes it. Sounds familiar to how benzos work, right? Yes, but barbiturates cause the channel to stay open longer, so that more negative chloride ions freely flow. Benzos cause the channel to open more often rather than stay open longer. Now, an interesting thing about barbiturates is that in very high dosages, they can influence GABA A receptors, hence open the chloride channel, without the help of the neurotransmitter GABA, which will allow the flow of chloride via the channel and cause hyperpolarization of the cell. Benzos can't do this. Now, let's talk about nursing responsibilities, side effects, and education pieces for the patient. In order to help us remember the main concepts, let's remember the word barbits. So it's a mnemonic, barbits. B for barbiturates and benzos differences. They each bind at different locations on the GABA A receptors. High doses of barbs can influence the receptor without the GABA neurotransmitter binding. Barbs have a low therapeutic index, no antidote for overdose. Benzos have an antidote called flumazenil. Benzos have replaced barbs for conditions like anxiety and insomnia. So A for abuse, addiction, dependence, high risk, long-term usage, history of substance abuse or suicidal ideations. R for recognize overdose signs and symptoms, no antidote. Supported with mechanical ventilation, most people die from respiratory failure. Dialysis to help remove medication from blood, and activated charcoal may be used. Educate the patient to avoid alcohol and other central nervous system depressants. So there's another mnemonic here for overdose signs and symptoms. Mnemonic lethal. L for loss of consciousness, coma. E for eye pupils, pinpoint and then progress to dilation and fixed as it progresses and body shuts down. T for tachycardia, so weak. H for have cold and sweating skin. A for absent reflexes. L for low and shallow respirations. And then back to the Barbiturates mnemonic. Be aware of patient safety. Barbiturates make patients feel very relaxed, drowsy, euphoric, and they won't be thinking clearly. Inform the patient about safety measures, such as help with ambulation, bed in lowest position with side rails up. No important decisions to be made while under the influence of this medication, or driving or operating any type of machinery or appliances that take concentration. In addition, inform about safety risks related to accidental overdose, addiction, withdrawal, and tolerance. I for index low, so therapeutic is in brackets. Monitor serum drug levels. Example, range for phenobarbital is 15 to 40 micrograms per milliliter. T for tolerance can develop. This occurs when the patient, or it says here, when the person cannot obtain the same effects from the drug and needs a higher dosage to get the same effects, which can lead to accidental overdose/death. Happens with abuse or long-term usage. S for stopping drug abruptly, especially after long-term use can lead to withdrawal signs and symptoms. In severe cases, a patient can experience these signs and symptoms as soon as 24 hours without the medication. So a mnemonic is craves for stopping the drug abruptly. And it's in brackets mild to severe. C for convulsions. R for restlessness. A for agitation. V for vomiting and nausea. E for elevated temperature. S for sleep problems. Can progress to shock and then death. References: Drug Facts on Barbiturates, DEA.gov 2021, retrieved 8 April 2021 from www.deA.gov/FACTS/BARBITURATES. And the next reference, Skibisky J, Abdi Jadid S. Barbiturates, updated 2020 November 20 in Stat Pearls Internet. Treasure Island (FL) Stat Pearls Publishing 2021 January, available from www.ncbi.nlm.nih.gov/books/mbk539731/. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out your YouTube channel, and feel free to share this video as well. Again, thank you for listening. I hope everyone has a great day.